Hello and welcome, I'm Tafara Gadamu. COVID-19 is now a reality. We're waging war. To state the obvious, crowded places provide the platform for the dissemination of the virus, and prisons or detention centers come to mind. Are we trying to address what could possibly become a disaster? That and more with Julien Lerisson, the head of the International Committee of the Red Cross Delegation in Ethiopia. A very warm welcome to the program, Julien.
Thank you very much. Thank you for having me.
Well, it's here. It's a fact. But the fact that we have only 2 people dead is no reason for optimism. Do you agree?
Yes, unfortunately, I agree. I see no reason for optimism with those people, unfortunately, who passed away. The virus is here. The virus is everywhere. The virus has hit the world. And I think there is no country spared, and there will be no country spared. The virus knows no border, no religions, no nationality, no ethnic group. It strikes us all, and we are all in this together.
Africa doesn't seem to be hit that hard as Europe is. But that's for the moment, right?
Absolutely. That's for the moment. I don't think we can hope or count on anyone or any country being spared. What we need to do is really work together on preparedness. It's all about prevention. It's all about social distancing, as you well done here with this table between you and me, as hand washing and understanding the issues at stake. And that the very fact, because it's a fact, it's not a question, that this virus knows no border, no religion, no nationality, does not make any difference between you and me. You're Ethiopian, I'm French, I'm so-called white, you're African, I don't know your religion, I used to be a Christian, so it doesn't care. It just strikes us all, and we are in this all together. We need to understand this and to work together to defeat it.
I see this at 2 levels. A, before it hits hard, as we stand today. The second level will come. And hopefully it doesn't, it would not. But if it does, it's going to be catastrophic because of the level, the health infrastructure that we have in Ethiopia. Good enough, but not that good enough to be able to accommodate all these, the crisis if it ensues. But look at it as the African continent, poor health infrastructure, shaky economies, conflicts everywhere, and the disaster is not going to be. It's going to be beyond our imagination if it does happen.
I hope not. You're right. If it does happen, we are just at the beginning, unfortunately. I think Africa stands behind Asia first and Europe in terms of wave, the size of the wave. You've seen, and everybody speaks about flattening the curve. Flattening the curve means simply reducing the rate of people getting sick for the health system, the health infrastructure, not to be completely overwhelmed. If 1,000 patients come and knock at the door of the intensive care units of any hospital in Addis, they can't cope. If they come 5 by 5, hopefully we will manage to cope and to help.
But it doesn't promise the end of this pandemic. Flattening it means there is possibly room for...
It means we are able to treat. For the time being, there is no possibility to get any vaccines to get rid of this virus. So the aim is really to be able to cope with the wave and the people coming, and to be able to receive them with dignity and to treat them with dignity, and to provide whatever health support it is possible at this stage. But there is no difference in the system. Look at Europe, look at France, Italy, Germany, even the US now. They are all overwhelmed. Their health system is overwhelmed. So I think Africa has proven some very strong resilience building capacity. But it's about all of us understanding this, all of us maintaining social distancing, all of us together understanding the risk and the threat that this virus brings to Africa and to the world in general. If we all together adopt certain measures and understand this, rely on trusted sources, listen to WHO, to the Federal Ministry of Health, to the EPHI, and abide by the set rules, we might manage to reduce the wave. I'm just giving you an example. When there is any prevention of an attack, imagine a terrorist attack. If someone comes like what happened in Paris in the Bataclan years ago, it killed more than 100 people. If you prevent this from happening, people will tell you, nothing happened. Why did you invest so much in prevention? Because nothing happened, it was a waste of money. It's the same here. If we manage to prevent it and to reduce the number of people sick and unfortunately dying from this disease, we will succeed. This is what we aim at, preventing and reducing the number of people infected.
Yeah. To be able to do that, I think your intervention is primarily focused in prisons, what you call detention centers, right?
Absolutely. The ICRC, our organization, works in conflict and violence-prone areas. And one of our area of expertise is prisons. And to help authorities coping with prisons from the arrival of any detainee in a prison until his or her release. So given the virus now, we've invested and changed our course of action, increased significantly our budget and our support to the prison authorities. As we speak, I have teams in Ethiopia supporting more than 27 prisons, federal and regional, distributing soaps to detainees, helping the authorities, setting up isolation centers, setting up hand-washing stations for detainees, basic prevention messages, because as you can imagine, this virus in an overcrowded place of detention is like a grenade in this room. It will kill us all.
Yeah. So how many prisoners are you reaching out?
For the time being, we've targeted 40,000 detainees, 40,000, but we will adapt and we might need to increase this. It was aimed at 20 places of detention. Now we are 27. We will probably go 30, 35, discussing with the authorities and seeing where the needs are.
How many in Addis?
In Addis, I think it's 4, but it's also all around in Oromia, in Amhara, in SNNPR, I mean, all the regions of Ethiopia.
How do you pick all these detention centers?
We discuss with the Federal Prison Commission.
And they tell you, here are the prisons that you need?
They tell us, we need your help there, or this, don't worry, we take care of that one. And we have a regular dialogue, same with the regional prison commissions, and we see, because you have big prisons, big places of detention, but also remote, smaller ones, but that might be more at risk because no access to water or very overcrowded, or the infrastructure is in a less good shape, I would say.
So the Federal Prison Administration picks prisons for you.
It's a dialogue. We do our own assessment. We have knowledge because we've been working in Ethiopia for more than 40 years now. So we know more or less, and we already had activities in all those prisons. So we discuss with the Federal Prison Administration, with the Regional Prison Administration, and we say, okay, look at this one or look at that one. Sometimes they tell us, you should go to that one. And the week after, they tell us, finally, there is another partner that can support us here. So maybe it's better for you to go in more remote areas. We always try to go in remote conflict, violence-prone areas that are more difficult to reach, whose infrastructure is in less good shape, and where we can bring value and where we can be impactful.
Are you talking about Walaga and Borana areas in Gondar?
Absolutely. The Welegas, East, West, and Kelem Welegas, Borena, Guji, East Alarge, the border with Fafan in Somali regional state, Northern Gondar, Metema, Benishangul Gumuz, Aronimuk, I mean many.
So these are the locations that you pick for yourselves to make this intervention, and the federal government says, okay, we agree to your intervention. Exactly. So why do you pick all these places? I mean, aside from the fact that these are found in potentially conflict zones or active conflict zones.
That's the reason.
That's the reason. So does that mean there are a lot more prisoners than there normally should be?
It's not necessarily that there are many more prisoners than there should be. It's just that the mandate of the ICRC is to protect and assist the most vulnerable people affected by violence or conflict.
Vulnerable in what sense?
Exactly. How do you define vulnerability? We define vulnerability in prisons as people that are out of the normal system, and so they are more at risk. Health, food, water, sanitation, it's more difficult for them.
So your assessment is all these places, all these prisons are less than desirable in terms of those.
They are more vulnerable. Vulnerability increase when you go in remote areas. If you take, for example, the Welegas, it's no secret that there is tensions and violence between the army, the police, and the governmental forces, and some other groups. And so because of this situation, civilian population and primary healthcare centers, hospital, ambulance services, prisons are less supported. They have more difficulty. It's a complicated place. It's more difficult to work there. So that's why we want to focus there, because this is our mandate, this is our activity, and this is our job to do that.
Now, does that also mean, I'm coming back to that question again, that, for example, a cell which can normally accommodate 10 people and made to accommodate whatever, 50 or 60 people, that makes them more vulnerable to...
Absolutely.
So do you consider that overcrowding?
Overcrowding is
overcrowding.
Vulnerability criteria, absolutely. And we try to focus on the prisons that are the most overcrowded, and it happens. And that's why also we have a dialogue with the authorities, and we welcome and we've discussed about the pardon and the release of many inmates with very minor offenses, because it helps reduce the overcrowding and improving the sanitation, hygiene, access to water, and so on in those places of detention.
So what do you tell the prison administration guys? Tell them the pretty obvious things. There's overcrowding, and you need to. What do you exactly tell them?
We discuss and we tell them about the plans, about the situation with this virus, and let's sit around the table and let's look at the virus being in your prison tomorrow. What happens? Where is the health facility? Do you have a referral system? Do you have an ambulance? With the isolation center, with the treatment center? How do you test the inmates? Do you isolate new detainees? What about the family visit? We can simply stop them. But then we know that many families in Ethiopia, they bring food to the inmates. So it's also in the interest of the prison administration. It's all those issues that we talk about with the prison administration in order to find solutions with the available means and resources. We know that the sky is not the limit. We don't have a crazy budget, so we try to find the best possible solution given the situation and the circumstances.
What would be the best solution?
The best solution is, for example, for family visit, to create like a space of 2 meters between the family and the detainees. The best solution is to set up even in a very small prison, very difficult place, to isolate one cell and to say any new detainees will be put a mask, will be brought to this cell for 14 days in isolation, the same way as the government is doing with any travelers arriving in Ethiopia. Simply to make sure that in case this person carries the virus, you can spot him, identify him, and without having contaminated the hundreds or thousands of people living in the prison.
Mm-hmm. So, social distancing, maintaining that distance, hand washing, and all these things, they're publicly available, information. Yes. What is new here?
There is nothing new. The idea is not being new.
So what you do is
disseminating, exactly, passing on the information. You look at the social media, it's full of fake news. People are thinking that you need to eat garlic, like that you will be immune from the virus. We know scientifically it's not true. It's important to rely on facts, and to all of us together try to do our help to pass the basic message. Avoid a close contact, handshaking, keep your distance. Don't share the food in the same plate. Even if it's against your culture, it's very difficult. But we need to be conscious about that, because we know the virus spread very easily and very rapidly. So we have to do our best to prevent it. Again, the aim is not to destroy literally the health system.
So were you the first to arrive on the scene when the virus cropped up in Ethiopia, at least was officially known to have arrived?
We were already here. We've been here in 40 years, so we were not the first one. We were not.
In terms of starting this conversation on addressing the pandemic in prison.
We were in prison, yes, because in prisons we've been working for many years. It's one of the activities that we have expertise in, so we try to do that. But we've been engaging with our main partner, the Ethiopian Red Cross Society, since the very beginning, and we've very quickly redirect our funds to the ERCS. The ERCS, the Red Cross volunteers, are frontline in this fight. Those are people, it's the biggest network of humanitarian workers in any country, and in Ethiopia it's the case. Those Red Cross volunteers wearing masks, setting up washing stations, passing on the message in the very remote and small villages. This is how we collectively will manage to fight this virus.
Is there anything new that you want to share with me, other than the fact that, the information that's being released from the Ministry of Health? I mean, they seem to be quite on top of it.
Yes.
With the dissemination of information, all that stuff. Is there anything you want to share with me as
There
far
is
as prisons are concerned? There are no infections and everything.
Infection prevention and control, basic messages, basic barrier measures need to be implemented. I think we all need to listen to WHO. We need to isolate, to treat, to trace, and to be able to together to identify quickly the people that carry the virus, and in order to isolate it. And then in prison, we need to do the same. But we should not forget the prisons. Prisons quite often are at the bottom of the list of the priority of any government. We, me, you, any human being, we have a tendency to think, anyway, they are criminals, they are in prisons, we don't care about them. No, they are your brothers, your sisters, they are your people. We need to care about them. Their only offense was done, and then they are in prison. The sentence is the prison. They should not be deprived of any other rights simply because they are in prisons.
They are releasing. I mean, the regional prison bureaus and whatever, and also the federal ones, they're releasing. That's a good sign, right?
That's a good sign.
Were you involved in advising the government to do so?
We advise. We have a dialogue with the prison authorities.
So you always raise it.
Advocate for what we call, sometimes we even discuss about humanitarian release. Like if you have a very old person, very sick person, that we can advocate for humanitarian release. And in that case,
on this particular
the virus, we have a dialogue with the authorities, and we've told them that, look, they should consider seriously pardoning the minor offenses and looking at ways, it's not us to say, but for them to look at ways on reducing the prison population. Because we know, it's obvious that if we are 100 in this room now, the risk for the virus to spread is much higher than if we are only 2. So it's the same with the prison. So that was our main message. It's not us to tell the government what to do or not, but we can simply advise and engage in a dialogue in that regard to reduce the risk of contamination in places of detention.
So you are also involved in conversations with the government for a fairly fresh design for prisons, right?
Yes, absolutely. Because of the expertise we have in places of detention, working all around the world with many different detaining authorities, we've noticed that the way prisons are designed is not always the best way. We think, government have a tendency to think super maximum security prison, but do not necessarily think about the path and the detainee. The detainee from the arrival in prison until his or her release, and the need for proper health care, the need for the right to practice religion, the people with disability. You might have persons with disability that are in prison. They need still to be able to move and to have the same rights as the other inmates. So that's why we have a good dialogue with the prison authorities on the design of prisons and how to make those prison designs the most efficient and adapted to the local context. I give you an anecdote. I was in Afghanistan like 5 years ago working in the southern part of the country, and some prisons, brand new, built by NATO or whatever government, they were running on 2 500 kVA generators. Who is paying for the fuel? Who is paying for the diesel to run these prisons? Very nice, you give the generators. After 1 month, there is no budget to pay for the fuel, no budget for the maintenance of the generators. It's useless. This is what we try to bring.
So what are you trying to bring? How does that translate to the realities on the ground in Ethiopia?
Why do you create a prison of that size? For example, in the same prison, it was individual cell. We know that in Afghanistan, people do not want to be in individual cell. You need to have communal cell. So this is the same, just triggering the interest and the reflection on what is the best suited with your culture, your environment, and how do you cope and with your resources. For example, diesel generators of that size, they are not adapted to the need. If you want to give a generators, reduce the energy consumption, don't put bulb or lights everywhere.
So what is it that you have for Ethiopia?
For Ethiopia, I cannot give you
specific things.
Anything.
Yeah, I know,
but it's the water, access to water. If there is no water, no need to make a prison in that place if there is no water, and the size of the cell, and who is able to come, the family visit. How do you make them? Because families will be waiting for hours in the shade, not in the sun, and so on and so forth. It's all those small details that we want to help, and we are discussing with the authorities in the design.
Okay, in the design. So it's interesting. Also, are you also does that mean that you're advising the government to demolish a few of those prisons that it's running?
It's not necessarily demolishing, it's readapting, trying to look at small adaptations and how we can sometimes breaking two walls and making a bigger room can help save cost and improve the living conditions of the inmates. Small things like that. We have engineer, architect, we have water engineer, sanitation, hygiene, electrician, and so on, looking at all those details and seeing how we can improve the conditions for the inmates with small interventions, no millions of dollars, we don't have them.
So do you also advise the government on how to handle prisoners? I mean, there's rumors of abuses going on in prisons, right? We are in transition.
This is the second main part of our work is first the conditions of detentions, as we've just discussed, the physical conditions of detentions. Second is the treatment of prisoners. And yes, we discuss with the authorities, we discuss with the prisoners, and we go back to the authorities telling them and advising them about the international standards, how to handle detainees, what is allowed, what is not allowed, improving their SOP, standard operating procedures and guidelines on how do you handle detainees in such a way. We do the same with the army when they wage war, when during the conduct of hostilities. We do the same with the police in terms of law and order, use of force and firearms, crowd control, search and arrest, and so on, because this is our job and we've been doing that a lot.
So the army is also deployed in several hotspots within in the country, right? So it's I guess it's very interesting in the training that you're organizing in terms of adopting the international humanitarian law to Ethiopia. I mean,
this is something we are investing in absolutely, and we want to have a dialogue, and we are having a dialogue with the federal army, with the federal forces, on how they wage hostilities, what is feasible, what is less feasible, and the basic rules of war.
So does your role also include monitoring?
Absolutely.
So how do you rate it now?
Monitoring, we have a confidential and bilateral dialogue with the authorities. So be it the police, the army, and so on. When we notice things, when people are reporting to us potential abuses, we go back to the army and we discuss with them about what happened and what could be taken as corrective measures. This, we do it everywhere in the world.
How often do you do that?
On a regular basis, depending on the situation.
Does regular mean?
But we have it's an open dialogue. We go in the field and we meet with the command post on a monthly basis, every 2 months, every 3 months, depending on the intensity of the violence and the conduct and what was reported to us and what we've noticed. And then we discuss with the commanders and we discuss how is it going and how to improve.
Are you encouraged by that conversation?
I'm always encouraged when we talk. I'm always happy when we manage to talk. The most important for us is to be able to maintain this important dialogue. The ICRC, the Red Cross and Red Crescent movement, we have basic principles, amongst which the impartiality, the neutrality, and the independence. We want to talk to everybody. We talk to Al-Qaeda, we talk to Al-Shabaab, we talk to Taliban, we talk to any government, we talk to anyone in the world about the very basics. I'm coming back to the virus. Impartiality, one of the principles of the Red Cross. We do not distinguish between ethnic group, religions, nationality, anything. The virus does the same. And it reminds us of the importance of this principle, that we should base our work solely on the needs of the people. And that's the same with the detainees, not to forget them and to always work to make sure that there is a minimum of humanity that we all share, that are still there, even in the darkest and the most remote and difficult places on Earth.
Well, Julien, on that note, I guess we have to end the conversation. Thank you very much indeed. It was a pleasure having you on my show.
Thank you very much. It was a shared pleasure. No, we can't. Thank you.
Sorry.
Bye.